Hi, I'm Dr. Papri Sarkar. I'm a board-certified dermatologist in Boston, and I'm here because Eczema Honey asked me to answer your questions about eczema today. Before we start, I wanted to remind you that this video is for informational purposes only. It's not intended for self-diagnosis or treatment. If you have any questions about your medical condition, please contact your board-certified dermatologist or your licensed healthcare professional. Let's see what kind of questions you guys had. One of the most common questions is, what is eczema and how can you tell the difference between it and other skin conditions? This is actually a great question, and it's a really complicated one. See, there's lots of different types of eczema, but the one that most people refer to when they say eczema is atopic dermatitis. Atopic dermatitis can start at any age, but it most commonly starts in childhood. Even though that's the case, I've seen it start for the first time in 70-year-olds or recur when someone's 70, even though they got it as a child. There's three major reasons that we think that eczema occurs. The first is epidermal barrier dysfunction. The second is immune dysregulation. And the third is an alteration in the microbiome of the skin. I'll go into a little bit more detail about those. In general, just so you know, what it usually looks like is a red rash with some fine dry scale on it, or just a little bit of dry scale on the skin. Over time, what can happen is that it can turn brown or tan, and you can get an increased prominence of the lines of the skin as people scratch or rub at it. Now, going back to what we think are the causes of eczema, epidermal barrier dysfunction essentially talks about the fact that the epidermis doesn't work as well as it should in eczema. Epidermis is the skin, and the function of skin is to keep things in and to keep things that are not supposed to be in our skin out. So in eczema, because of inflammation, what winds up happening is that our skin doesn't do as good of a job with that as it should. It doesn't provide a barrier anymore. With breaks in the barrier, what happens is that you get transepidermal water loss or loss of moisture and water from the skin. In addition, it can let in irritants very easily so that you get more inflammation. The second thing that I talked about is immune dysregulation. And what that essentially means is that people with eczema have skin that reacts way more than it should to common everyday stimuli. They're more sensitive to things in the environment than other people are. And that causes inflammation. The third thing is an alteration of the microbiome. What that means is that people with eczema have a different number and a different type of bacteria on the skin than other people do. It means that their skin actually can get infected more frequently than other people. It's partially because of the bacteria that's on the skin, and it's also partially because their immune system of the skin in particular reacts differently than other people's. Why does eczema come and go on different body parts or in different seasons? This is a great question. So there's a natural progression to eczema. In infants and young children, eczema tends to present on the face, on the back of the arms, on the front of the knees, on the ankles and the buttocks. But as kids get older, it naturally moves. It naturally starts presenting in other places. So it can start on the inner arms, on the back of the knees instead, and it tends not to affect the face quite as much. This is just something that tends to happen as people get older. We don't know exactly why, but it's very, very common. In terms of different seasons, eczema can really flare during any season. It's very common for people to have a flare of eczema in the winter when it's really cold and dry outside. Our skin tends to be drier during that time, and the hot air in the environment from forced hot air heating can actually dry it out even further. The air is also very dry, so all these things contribute to it. But some people have eczema that flares in the spring because they have seasonal allergies. And as their seasonal allergies flare, their eczema flares as well. In addition, in the summer, for some people with eczema, they're sensitive to sweat. It makes them really, really itchy, their own sweat. And so they tend to flare in the summer. And for some people, they flare in all three. The only season that tends to not cause a lot of problems is the fall, unless you have fall allergies. So there's no safe bet as to when your eczema will flare. It really depends on you as a person. In general, though, most people flare in the winter when it's really cold and dry outside. Can eczema go away or be cured? Eczema is a really common condition, and some children outgrow their eczema. Usually if they're going to outgrow it, it's usually by age 12 to 15. If not, it's something that they tend to live with and is a chronic condition, but we can control it. In addition, it can wax and wane based on how they're feeling, if they're sick, if it's allergy season, if it's winter, and again, we essentially treat it, but there's no real cure for eczema. Does eczema come in different forms? Yes. There are lots of different kinds of eczema. It's important to know which kind you have because each kind of eczema has a different trigger or treatment. So it's really helpful in terms of treating your disease. We already talked about atopic dermatitis, right? But the other kinds of eczema are nummular eczema, stasis dermatitis, dyshydrotic eczema, contact dermatitis, and seborrheic dermatitis. So those are all different types of eczema that also exist that we won't talk about today, but they all have slightly different triggers and treatments than atopic dermatitis. What causes new flare-ups in new places to occur? So we talked a little bit about how the natural progression of the disease is that eczema will change where it presents in an infant versus an adult or an older child. But what we find is that in general, eczema can really present anywhere. So eczema can be on the scalp, it can be in the private area or the genitals, which really actually scares people sometimes. They think that it's something that they got that's contagious, and it's not, as long as it's truly eczema. So you should see your doctor about that just to make sure that's what it is. But in general, it's just natural progression for it to be able to really appear anywhere and also to change as you get older in terms of where it presents. How do I narrow down what's causing my dermatitis? That's a great question. I usually recommend keeping a diary for patients. So if you're going to go in and see a doctor like an allergist or a dermatologist, make sure that before you go, if you can, you keep track of when your skin is flaring and how it's related to things like eating foods, being around animals, or seasonal allergy type triggers like hay or trees or pollen. In addition, medications that are new or that you take regularly or even infrequently, illnesses like colds can trigger asthma, and stress is a really big one too. So if you're stressed, a lot of inflammatory things can increase, including acne, psoriasis, eczema. Once you put all that in a diary, if you bring it into your doctor, they can really help you figure out what's triggering your eczema in particular. Does stress have an impact on eczema? Absolutely. Many diseases, many, including eczema, really flare with stress. We find that stress is responsible for causing your skin to age more, flaring acne, flaring psoriasis. Any of the inflammatory diseases really can flare with that. And so as much as you can minimize stress, the better it is for your skin and for your overall health in general. Usually what I recommend is things like meditation or investing in an exercise program. It could be just running outside, or yoga, or a meditation, whatever you prefer. Anything that can help decrease your stress is really great, and anything that lets you sleep a little more is also wonderful. If you like this video, please like or subscribe to it so that we know that we should make more. If you really enjoy it, please share it with a family member or a friend. And if you have any questions, leave them in the comments below and we'll answer them for you.